Just go. Thank you for your patience.
These are good. My colleagues are going to join me. That's student Dr. Danielle, student
Hi.
Dr. Daniela, and student Dr. Jared. Okay. And my name is Jose Chavez. How was the drive in today?
Okay.
It was okay. What's your name?
Zion?
Zion. Okay. How would you spell that?
Z-I-O-N.
What is your last name?
Alexander.
And how old are you?
20.
20. So do you live in Edinburgh?
Mission?
Mission? And what do you do in Mission? What's your employment?
No, paralegal.
Paralegal? And where did you go to school?
STC?
Excuse me?
STC?
South Texas College, correct?
Mhm.
Cool. And how long have you been working as a paralegal? 5 years? Awesome. So tell me, what brings you in today?
I have this pounding headache that just won't
Okay.
go away.
Can you tell me where is it located? Where do you feel the in your temporal? Now, when does the headache occur? Is it constant throughout the day?
Sorry, can you repeat that?
So when do you feel that pain, that headache? Is it just constant throughout the day, or is there a certain time of day that you feel it
When I'm working.
when you're working? What about when you get home from work? Does it go away? Do you feel fine after that?
Sometimes it keeps going.
Sometimes. And is this a problem that you've had before, or is this something that's new?
It's been going on for like weeks.
Okay, for weeks. And do you have, could you maybe think of a certain event that may have caused these headaches? Are you able to recall anything that may have induced the headache? Did you have an injury?
Sorry, can you repeat that?
Sure. So if you're having pain in your head, you're having headaches that are pretty constant throughout the day, are you able to recall any sort of event that may have led to the headaches? No? Okay. Let me ask you, how are you pretty comfortable sitting down the way you are there? Did your back's not hurting or anything? No. And besides the headache, is there anything else that brings you here? Or is that your main overall concern?
That's my main concern.
What have you taken to sort of alleviate the pain?
Tylenol?
Tylenol? And has that helped you?
Not really.
No? How many pills of Tylenol do you take? One per day? One per day? Okay. Before I get your family history and other pertinent stuff, information about you, I'd like to go and perform some cognitive tests to make sure that you're that this isn't as serious as it could possibly be. Okay. Okay. So I'm starting from 100, count down 7, and then just keep going down until I tell you to stop. Okay. Subtract 7 from 100 and keep going down. Okay. Go ahead and start.
93.
Okay. It's okay. It's okay. No, no, it's fine. Let's just try count. Let's try counting down from 50 using only 5. So count down from 50 minus 5. Go ahead and start.
Okay, 45.
Okay.
40.
Okay.
35. 20. And then 25.
Okay. Now, that's good. It's okay if these are all important tests, so we could it's gonna help both of us pinpoint the preferred treatment for your headache. Okay, so don't feel bad. It's fine. So now I'm gonna say a word, and I want you to spell it, and then I want you to spell it backwards. Okay, Earth. Spell the word Earth.
EARTH.
Okay. Now if you could spell it backwards.
HTRAE.
Good. That's good. That's good. It's really good. Okay. So, who is the current president of the United States?
Obama.
Okay. And what state do you live in?
Texas.
And who is the governor of Texas?
I don't know.
Okay. What about, so currently there's an election going on. Who's on the Republican nomination and who's on the Democratic nomination?
Donald Trump.
What party is he associated with?
Republican.
Okay.
And Hillary Clinton. Democrat.
Okay. Cool. So I'm gonna ask you to draw a clock on this piece of paper, and what I want you to do is draw a clock pointing at 6:30. So draw the hands, making it appear like it's 6:30. Just anywhere is fine. There you go. Do you mind showing me just so I could see it? Yeah, that's good. Perfect. Thank you. So it does appear that we're gonna have to have a follow up, maybe perhaps a CT scan or some sort of test, so we could get that proper diagnosis to alleviate your symptoms. Okay. Before I pursue that, though, I do need pertinent information regarding your background, your past, maybe medical history, past medications that you've taken, any allergies. So I'll go ahead and start there. Okay. Are you allergic to any medications?
Sorry. Can you repeat that?
Yes. Are you allergic to any medications?
No.
No. What about Have you ever been hospitalized before?
No.
No. Do you see your doctor regularly?
No.
No. When's the last time you've have seen a doctor?
I don't remember.
It's been a while.
Yeah.
Because it's been a while, do you have all your immunizations?
There are 5 minutes remaining in the
No.
encounter.
Okay. I'm gonna tell you 3 words, okay? And then at the end of the interview, I'm gonna ask you to just tell them back to me, okay? The 3 words are Spica, Antares, and Polaris. Okay? Can you repeat those back to me really quick?
I don't remember the first one.
Spica?
Spica, and Taurus, and Polaris.
Good. That's perfect. Okay. So you have a headache. Has that affected your vision at all?
No.
No. And what is your overall mood? You know, from your work environment to your home environment. How do you feel?
Tired.
Tired?
Sluggish.
Sluggish?
I can't concentrate.
Okay. Okay. Does this translate to maybe do you ever get sad or do you feel any sort of depressed? No.
No.
No. Have you ever had any either physical trauma or emotional trauma? No. So you've never had any thoughts of suicide or homicidal tendencies? No. Okay. Okay. And what was my name? What's that? Good. That's good. Perfect. Okay. And just to sort of get a summary of when exactly did your headache begin? I know you said it's been a couple weeks, but can you give me maybe a little bit a more narrow time frame?
I don't remember.
No, but it's been there for a couple weeks.
Yes.
Okay. And so you say you feel sluggish, that you've had poor concentration at work. Has this affected how you do your job? Have you received any feedback from your superiors or from your colleagues there?
Not really,
No?
but guessing they're like kind of suspecting.
They're suspecting something may be wrong?
Yeah.
But they haven't told you anything? You haven't been reprimanded or no? Do you personally feel that your work has been up to par, or do you feel that you may be able to do better if this headache would go away?
Can you repeat that?
Sure. How do you feel your performance is? You said your colleagues.
Encounter is over. Please exit the room.
Okay. So earlier I told you to repeat me 3 words. Can you repeat those?
Spica, and Taurus, and Polaris.
It was Spica, but that's good. I mean, that was a hard word. So yeah, okay. Thank you, Zion.